Welcome to BriefBites for Better Care. This episode is about disrespectful behaviour. Now, we can all think of people who stand up for what's right, even if they have to stand up against the system they work in. And when they do that in the best interests of the patient, that's a good thing. We admire them. Standing up for what is right for the patient is quite different from disrespectful behaviour. Disrespectful behaviour is a threat to patient safety. Lucian Leap suggested 5 types of disrespectful behaviour. Some are obvious, but others might surprise you. The first is disruptive behaviour. The person who shouts, who threatens, who intimidates, who throws things, or who just doesn't listen. In the past, these people, particularly when they were senior clinicians, were tolerated. They were regarded as colourful characters. But no longer. They're not colourful characters, they're just disruptive. The second type is humiliating behaviour. People who use verbal abuse, who treat junior staff as if they are useless and in their way, who verbally abuse others and belittle them. The third variety is passive-aggressive behaviour. This is a pattern of negative attitudes, passive resistance to instructions, always late for meetings. They resist following safe practices, they're uncooperative, they tend to blame others, and they're critical of authority. The fourth variety is people who are dismissive of patients. These people make patients feel stupid. They ignore the patient's questions. They imply that the patient is wasting their valuable time. And the fifth variety is systemic disrespect. Making patients wait, not informing them fully, not interested in improving staff working conditions or morale. This behaviour is sometimes seen, sadly, as normal in the health system, but it's never normal. It's disrespectful. So why does this happen? Well, some organisations just have a dysfunctional culture that breeds disrespectful behaviour. They have their eye on the wrong ball. They discourage and criticise their staff rather than supporting them and developing them. Some health professionals have a sense of privilege and status, and that doesn't help. Others have had poor role models in their training and they just copy that poor behaviour that they learnt when they were younger. And some, feeling that they just can't change things, tolerate it. They might even embrace it. But disrespectful behaviour is dangerous. It interferes with good teamwork. It stifles open, honest communication. It undermines morale, and it's a poor role model for junior staff. That's why it's a serious threat to patient safety. Good healthcare is about respectful behaviour. That's a moral value in its own right. See you again on BriefBites for Better Care.